This is Michael Bagraim on Monday the 4th of May 2020 of the Democratic Alliance. I am the Labour spokesperson for the Democratic Alliance, and today is the first day many businesses came back to work, and it's interesting to see how many of the businesses complained and how many of the businesses tried to adhere to the regulations. The Minister of Employment and Labour, Minister Thulas Nkezi, sent out a new regulation, Regulation 10.8. That's the health and safety regulations. He had signed that off on the 28th of April 2020, but it's important for all businesses, employees and trade unions to understand the legislation and the regulations. Everyone is still bound by the occupational health and safety regulations, and in fact the regulations now put out by the Minister make it a lot stricter and a lot more difficult for businesses to comply. But it is absolutely vital that the businesses do comply. Non-compliance will lead to warnings, compliance orders, and possibly even prosecution. To not comply with the regulations could be a criminal offence, and we don't want to see any businesses getting into trouble. We also don't want to see people getting infected now at the newly opened workforce. It's almost 1 million more people have come back onto the workforce. So the Minister did say, as reasonably as practical, you must ensure that your customers, clients, contractors, workers are kept virus-free, and that goes for self-employed people as well, who are expected to ensure that they have contact with the public in minimal circumstances with gloves and sanitizer, etc. So even self-employed people and independent contractors would have to follow this. Obviously, there permitted employers are back at work, and that goes to the essential employers as well. Obviously, those employees that aren't bound by the occupational health and safety regulations, they're not bound by this either. And of course, certain medical healthcare services won't be bound at all. They have their own protocols and their own way of dealing with the health and safety legislation. There are 3 types of businesses in terms of the numbers of employees that they have. Obviously, a business that has under 10 employees, it's a lot easier to handle. Those between 10 and 499 is a different level, and then those above 500 again is a different level. And it is recommended that every single business reads the health and safety legislation and regulations so that they don't fall foul of the regulations at all. We don't want an inspector to arrive at anyone's workplace and to say that they're falling foul of it. The inspectors can close workplaces, they can issue fines, and they can even take criminal action. So we don't want to see that at all, and we must very carefully read these regulations and try and understand it. If anyone doesn't understand it, they can get hold of me on michael@bagraims, BAGRAIMS.co.za. We need to get it right, and we don't want anyone falling foul of the regulations as put out by the Minister. The Minister has to send out more regulations in due course, but in the meantime, we know that these regulations hold good, and that all the staff should be made aware of what the regulations are. Staff have to understand the contents of the regulations. They also have to understand that if anyone's ill, they should report it in. They must report it in. And in turn, the business has to report that to the Department of Health and the Department of Employment and Labour. The businesses over 10 employees must appoint a manager or someone in charge of health, and that person would at the end of the day become the person who would be explaining to the workers what has to be done, why it has to be done, and to explain that they need to follow the regulations. Obviously, we've all been doing this, but when workers arrive, they must come with a mask. The mask has to be supplied by the business, but if they don't have their own, it'll be supplied. Most businesses have been told to supply their staff with at least 2 masks so they can wash the one. Businesses have to do that. They also have to have plentiful hand sanitizer so that people can not only clean their hands, but also at the end of the day, anyone visiting those premises would have to do that as well. So all workers must be informed of all their rights and all their duties in the circumstances. If a worker is obviously diagnosed, the employer then has to inform the authorities, both health and labour, and they must investigate the workplace. The Department of Health will investigate, they'll review the situation, they'll review the risk plan. Every business can put a risk plan together, and they'll review that and decide what happens with the business. We want to try and keep as many businesses open as possible. There must be social distancing. It's 1.5 meters. If you can't have 1.5 meters, then they're asking for physical barriers, even perspex between the people, so that people don't infect each other. What we're seeing is that the workplace itself has to avoid any groupings or contact between people. So even in the canteen, you would expect people to go at different times and people to keep apart from each other. It's the same in the toilets. It would be the same in boardrooms and meetings. Try and keep that to a bare minimum. If someone is showing symptoms, and you would normally test people as they come in, you would test their with a thermometer. There are lots of these thermometers that don't touch anyone, and they can see whether someone is showing any symptoms. If the person says that they're showing some symptoms, again you would send them in for testing and to see if they're in fact entitled to come back to work. If they do present as positive, then we're going to have to get the inspector to come in and investigate the rest of the staff that they were in touch with. It's a bit of a nightmare, but unfortunately we have to go through with it. We have to follow what is going. If someone says that they have body aches, loss of smell or taste, nausea, vomiting, fatigue, weakness, any of that, I would expect you to then ask them to go and get themselves tested so that you don't in any way expose the rest of the staff. If someone is sick, obviously you would apply for the TERS. You can still apply. They did initially say that it was going to come to an end, but people can still apply. If in fact they're diagnosed as positive and it can be shown it comes from the health problems that have come from the workplace, they then can claim against workmen's compensation. Although workmen's compensation has been wholly inadequate over the many years, we're hoping that they've set up at least a system now to cope with this. They need to obviously show that it was contracted at work or to and from work, and then they've got a claim in terms of workmen's compensation. They can only return to work if they've undergone a further medical examination and they now confirm negative. Obviously you need to look very carefully at personal hygiene, wearing a mask, social distancing, and cough etiquette. I know it sounds strange, but cough etiquette is very important. Hand sanitizers must be 70% alcohol content, and they must be free at the workplace and sufficient for both staff and visitors that come in. Remember, 2 masks per person. Small businesses, less than 10 employees, 1.5 meters apart. Showing any symptoms, please go and investigate. If you need any further information on this, phone 0800 02 9999. I did try the number. It seems to be working, but keep trying. You can get more information there. You have to provide cloth masks free of charge to all people in small businesses, and you must do your own risk assessment. Thank you for listening to me. It's Michael Bagraim of the Democratic Alliance on Monday the 4th of May. Thank you.